Tendinitis. Let's talk about that. Remember, today we are about to truly understand it. We are just not here to only define it. Now, someone will ask me and you to begin with, what is a tendon? Now, let's break it down. A tendon is the structure that connects our muscles to our bones. So anytime a muscle contracts to create movement, the force has to pass through the tendon first. Now, tendons are constantly under stress. Tendinitis happens when that tendon is overloaded, not from one big injury though, but from repeated stress over time. What are some common causes then? Repetitive movements, overuse without enough recovery, sudden increase in activity or training, poor posture or poor movement mechanics. It is very important. Now, remember, this is not a random problem, this is an overload problem. Here is where a lot of people also get it confused. Now, in the early phase, tendinitis is true inflammation. Now, our tendons become irritated, they become swollen, and eventually they become more painful. So, at this age, rest, ice, anti-inflammatory treatment can actually help. But let's say if the stress continues and the healing never fully recovers, remember the condition is slowly going to change where the tendons enters into a chronic phase. That means the inflammation will decrease, the tendon fibers start to degenerate, the collagen becomes disorganized, blood supply is poor, and the healing eventually starts slowing down. That's why chronic tendinitis behaves differently. Patients describe this pain as stiff and painful in the mornings, and it worsens at the start of any movement. And slowly, slightly, it starts getting better once you start warming up. Then it gets worse again after an activity. It is very important. Now, that pattern is a classic tendon clue. Know this, that tendinitis pain is very localized. Now, patients can usually point to the pain with one finger right over the tendon, and this is very important. Remember, tendinitis is not a muscle pain. Now, muscles have good blood supply. Muscles heal quickly. Now, tendons heal slowly. So, ignoring this pain or pushing through it makes the condition chronic instead. Let's talk about some management. Remember, treatment is just not only medication. Now, proper management is what is needed here. What are some proper management then? Reducing the activity that causes the overload. Now, complete rest though. You need to also make sure that you ice during the acute phase, stretching tight around that surrounding muscles, gradual strengthening, especially controlled loading. Now, steroid injections may also reduce the pain, but remember, they are short term. They do not repair the tendon structure, and overuse can weaken the tendon. So, what many people make mistakes in is treating the pain but continuing the same movement pattern. So remember, tendinitis occurs when load exceeds the tendon's capacity. What we need to do is to reduce the load, correct mechanics, allow time to adapt. And remember, with that being said, the tendons are going to improve. A lot of people need to understand. In the comment sections, there are so many doctors, so many pharmacists, nurses who are willing to teach you. If you have any problem, please comment. Me or one of my team members, somebody in the comment section understands the health dilemma very well. Someone is going to help you. My name is Nurse Solomon. Tendinitis has caused so many problems. You know a lot of people with that condition. I know a lot of people with that condition. I'm going to see you soon.